So urinary tract infections, kidney specialists do handle these quite commonly. They're also commonly handled by primary care doctors. Commonly, of course, women would have them. Again, this is an anatomical thing. They have the shorter urethra. It's commonly caused by bugs which come from the GI tract, from the gastrointestinal system, and so any feces or anything like that can easily have bacteria which can get into get into the urethra of people and patients. By and large, E. coli or Klebsiella are the most common bacteria that we see and that we treat with common antibiotics, and typically they're relatively easy to treat. Now, a few things we should say, some nuances of kidney medicine. In an adult who's otherwise healthy and has no symptoms of a urinary tract infection, in a female especially, if we do find evidence of bacteria, we don't treat it. Now, this is crucially important. Sometimes what I would do is I would give them a prescription not to be filled unless they develop symptoms. The reason for this is important. Colonization of the bladder, of the urine, is extremely common with bacteria to cause a few bacteria and a few white blood cells, no symptoms. And so giving antibiotics doesn't make people feel any better. Well, now they've got to deal with the side effects of the antibiotics. What this also does is it kills off the bacteria which happens to be happily colonizing the bladder, and then what re-emerges is now a resistant bacteria. The antibiotics no longer work, and so now we're limited in the antibiotics that we can prescribe. And so we've really gained nothing by giving people antibiotics in this scenario. If the bacteria just come back, now they're resistant, and now we're stuck. Urinary tract infections of the lower urinary system of the bladder, very, very common, something that we do tend to treat quite a lot. We recommend certainly antibiotics in those situations and urine cultures to see what the sensitivities are of those bacteria. Other basic recommendations include making sure that you're wiping properly, keeping clean properly. If people come in, they have recurrent urinary tract infections that just simply don't go away. At that time, typically we'd send them to see the urologist as well. The reason for this is there could be some predisposing factor that we're missing. For example, the bladder may not be fully emptying. In a female, for example, the bladder can be falling down into the vault of the vagina, and so when she empties, it's not fully emptying, you get a small amount of urine which is infected and is stagnant and will continue to infect the urinary system. And so that could be treatable with other practices like pessaries and things like that. Now, in someone who's a teenager and they have urinary tract infections, we need to be more mindful of sexually transmitted diseases, and this is something that we'll actively look for and seek as well. In older populations, if they have certain risk factors for sexually transmitted diseases, we'll go after those as well. Typically we can tell from a thorough history as well in chatting to people.